Yellow fever is a viral infection transmitted by the Aedes aegypti mosquito, which thrived in tropical and subtropical climates. The disease originated in Africa and spread to the Americas through the transatlantic slave trade during the 17th century. This facilitated the transmission of the yellow fever virus, as the mosquito vectors bred in the water-filled ship holds carrying slaves. The yellow fever virus is primarily a zoonotic disease, circulating among monkeys and mosquitoes in the jungle canopy. Humans become incidental hosts when they enter this cycle, or when urban mosquitoes, primarily Aedes aegypti, transmit the virus from one human to another. The disease is characterized by high fever, chills, severe headache, back pain, general body aches, nausea, and vomiting. As it progresses, it can lead to jaundice, bleeding, and organ failure. The spread of yellow fever was historically facilitated by the proliferation of its mosquito vector, which breeds in standing water often found in urban environments. The development of large urban areas without adequate sanitation and water management in the tropics and subtropics allowed the disease to become endemic in many regions. The expansion of colonial empires and increased international trade and travel also played significant roles in the spread of yellow fever. The widespread impact of yellow fever is also attributed to the lack of immunity among newly exposed populations, particularly in the Americas during the 17th and 18th centuries, leading to devastating epidemics. Control efforts have historically focused on mosquito control and vaccination. The creation of the yellow fever vaccine in the 1930s was a pivotal moment in combating the spread of the disease. Despite these efforts, yellow fever continues to be a significant public health threat in parts of Africa and South America, where it causes outbreaks among unvaccinated populations. The disease's persistence is due to several factors, including the reinfestation of areas by Aedes mosquitoes, waning immunity in populations, and challenges in vaccine distribution and mosquito control efforts. Yellow fever has been a significant health threat since its emergence, particularly evident during the 17th to the 20th century when it caused numerous devastating outbreaks across Africa, the Caribbean, and the Americas. These epidemics frequently led to high mortality rates, with some claiming thousands of lives, including during the infamous late 1790s outbreak in Philadelphia where over 5,000 people perished. The disease also severely impacted the populations of New Orleans and other southern U.S. cities in the 19th century. The economic impact of yellow fever was profound, particularly in regions striving for development. The disease affected labor forces dramatically, most notably during the construction of the Panama Canal in the early 20th century, where it killed thousands of workers, and similarly hampered military campaigns. For instance, during the Spanish-American War, more American soldiers succumbed to yellow fever and other diseases than to combat actions. Control and prevention of yellow fever have evolved significantly over the years, initially focusing on mosquito control once it was discovered by Dr. Walter Reed and his team that the Aedes aegypti mosquito was responsible for transmitting the virus. Efforts to control the mosquito population included draining swamps and improving sanitation to eliminate standing water that served as breeding grounds for mosquitoes. These measures were critical in reducing the incidence of the disease in affected cities. The development of the yellow fever vaccine in the 1930s by Max Thaler, who was awarded the Nobel Prize for his work, marked a turning point in the fight against yellow fever. Vaccination campaigns have since played a pivotal role in controlling the spread of the disease, with the World Health Organization now coordinating these programs in endemic countries. Moreover, historical strategies like quarantining ships from affected regions and requiring vaccination certificates for travelers have helped manage the spread across borders. Public health campaigns have also been instrumental in educating populations about the risks associated with yellow fever and the importance of mosquito control and vaccination. These educational efforts continue to be crucial in preventing outbreaks. Despite all these measures, yellow fever remains a threat in tropical areas where the Aedes mosquito is prevalent, particularly in parts of Africa and South America. Recent outbreaks underscore the need for continued vigilance in vaccination, mosquito control, and public health preparedness to manage and eventually eradicate this disease. Yellow fever remains a significant public health concern, primarily affecting tropical regions of Africa and South America, while it has been largely controlled in North America and Europe due to effective mosquito control and vaccination campaigns. However, the disease is still endemic in 47 countries, with a majority in Africa, where it continues to cause an estimated 30,000 deaths annually, predominantly in these regions. The primary method of prevention is through vaccination, which is both highly effective and cost-efficient. The yellow fever vaccine provides immunity within 10 days for 95% of those vaccinated and offers lifelong protection. Despite its effectiveness, challenges such as logistics, funding, and vaccine hesitancy hinder achieving comprehensive vaccination coverage. As a precaution, the World Health Organization (WHO) recommends routine vaccinations for children in endemic areas and mandates travelers heading to these regions to get vaccinated. Travelers are often required to carry the International Certificate of Vaccination or Prophylaxis (ICVP) to enter certain countries, ensuring they are protected against yellow fever. Mosquito control is another critical preventive measure. This involves habitat reduction efforts such as removing standing water sources where mosquitoes breed, using insecticides, and promoting personal protective measures including the use of mosquito nets, repellents, and wearing long-sleeved clothing. Public education campaigns also play a crucial role in raising awareness about the importance of these strategies to prevent the disease's spread. Moreover, enhancing surveillance is vital to detect and respond to yellow fever outbreaks promptly. This includes maintaining and expanding laboratory capabilities to confirm suspected cases and deploying emergency vaccination teams to contain outbreaks quickly. Collaborative global health initiatives like the Eliminate Yellow Fever Epidemics strategy launched by WHO aim to protect at-risk populations, prevent international spread, and contain outbreaks rapidly. This strategy is focused on increasing vaccine accessibility, improving disease surveillance, and bolstering emergency response systems in high-risk countries. Continued international support and cooperation are essential to manage and eventually eliminate the threat of yellow fever, particularly in endemic regions. The global health community's ongoing efforts are crucial in striving towards this goal, emphasizing the need for sustained public health strategies and international collaboration.